to put your name into and contact information into the chat, please take a minute and do that. We are recording that session, so if you are not interested in being recorded, please disconnect from the session. We store our recordings on our Canvas as well as our webpage so that you can go back and review these or watch them again. We've all been on Zoom for quite a few years, so we all probably know how to rename our profile and raise our hand, but this slide just tells us in case this might be our first time we've joined Zoom. We talk about some pretty sensitive topics in our ECHO sessions, so always remember to protect individual privacy. Don't use first or last names or any identifiable information. If you have any questions, please reach out to one of our great hub members. They all have an asterisk in front of their name, so you can find them in the chat. ECHO is a really interactive community where we have presenters, our hub members, as well as you all attending to support each other in that session. We really encourage that participation. So if you have any questions or want to reach out to everybody, you could put that in chat, but also finding your colleagues and coworkers on here and asking those questions. Another great way to do it is case narratives. It's really a great way to share information, learn from your colleagues. So if you're interested in doing a case, please reach out to us and consider doing one. Again, the key components of an ECHO session is really to build that community of practice. If you have questions, knowing who in your community to reach out to. We have a didactic speaker as well as a case presentation and then our recommendations for that case. Case studies, again, are a great way to get information and feedback and to be able to take that back and apply it. If you're interested in doing one of that, reach out to Project Scope at usu.edu. In order to get a certificate of attendance, we ask that you fill out an evaluation that is sent to you. Those evaluations are sent at the end of the session and consecutively the following weeks. We really appreciate those survey results. It's where what we use to be able to keep these sessions free and be able to share that with our grants and well as everything else. So please fill those out. And a huge shout out to everybody who has already completed that survey. Kurt, you just came off mute. Do you want to?
Yeah, I just wanted to say there's been one or two people over the course of the different sessions for Scope that's had a difficult time because their mail server identifies it as spam, so won't let it be delivered. And so sometimes I may reach out and say, do you have another email to send it to? So just be patient with me because sometimes it's on that end of the person receiving, sometimes it's on our end, but we'll try to get it figured out so we get those surveys out. So if you don't get it, it's not in your spam box, not in your inbox, please reach out to me and we'll see what we can do about making sure we get it to you.
And that comes from RedCap. Is our survey collector, and sometimes that does go to your spam, as well as sometimes the Canvas invite does. So if you have any questions about either one of those, please reach out to either Kurt or Project Scope and we'll be able to answer those questions for you. On our Canvas site is where we put all of the recordings, PowerPoints, handouts, the case recommendations. So if you were in a breakout group and there was some ideas about a case and you wanted to know those, you can go back and look at those case recommendations as well. And then I'm just really excited today to introduce Carissa Mcdonald. She is a peer recovery coach. She's going to tell us about her story and share that with us today. And she just is a great presenter on that. We have social media that we have some resources on. If you've not followed us on that, please take a minute and do so. And then our next session, just letting you know, will be June 27th. where we will be talking about trauma, substance exposure, and sensory concerns. So I'm going to stop sharing and let Karissa just take that away.
Thank you so much. So my name is Carissa Mcdonald. I'm a certified peer recovery coach with USARA. Here with me today, I do have Vanessa. She's logging on right now. She is also a certified peer recovery coach for Arches as well. I will go into briefly what Arches is about. It's addiction recovery coaching in healthcare and emergency settings. And then after I do my intro, I will explain more about that. So my recovery date is November 25th, 2017. By the grace of God, I continue to reach out to people that are ready to get into long-term recovery, but as well as people that are just planning on harm reduction and aren't ready yet. The main goal when I got sober was to make sure that I reached my hand out like others reached their hand out to me. I've had substance use disorder for as long as I can remember. I did have what you would call a broken family growing up. I had a father that actually succumbed to alcohol and passed away when he was 46 years old. And my mom left him when I was only 7 years old, and I didn't understand why. Growing up as a child, I just felt abandoned, and I felt that something was wrong with me. And at a very young age, I started to experiment with drinking. And, you know, unfortunately, when you're really young like that and you have some displaced anger and hurt and depression, it's very hard to transition from youth into a teen. And I didn't know how to do that, and I didn't have the support to do so. So I did the next thing that I knew how to do, and that was to use substances to not feel, to not hurt. And at a very young age, I actually got addicted to opiates. And I was 15 years old going to school, and you know, my friend, we were in gym class and we had both been in the locker room, and she had asked me if I have ever tried heroin. And I was just shocked. I was like, absolutely not, I haven't. And she's like, it's not as bad as you think. And right then and there, I was like, well, she is my peer. Looks like she's fine. And why not? Let's try it. I've tried weed, I've drank, and I smoked. And so that was kind of the gateway. And when people say weed is the gateway, I believe that even nicotine can be the gateway. And that's one thing that I've explained to my daughter that is 12 years old and in the same situation as me when I wanted to transition. And so with that being said, it calmed my emotions. I didn't have to think, I didn't have to feel, I didn't have to hurt. And it was, for once, I had a bliss of feeling okay. And that's when it all began. And I did get, you know, I did have some abstinence along the way. My mom she was very supportive. She did everything that she could. And with that being said, I got pregnant at a young age and had really bad postpartum. And I was addicted to pills this time. And I didn't feel like it was a problem because they were prescribed to me. And it only increased more and more and more until I went to heroin and eventually shooting up heroin. And I was to a point where I wasn't in control anymore. And that's the scariest thing, is when you feel like you're not in control anymore, because it's fight or flight mode. You know, my survival tactic was to look for heroin and then look for heroin for the next day. And that was my life for a really long time. I did get in trouble with the law. I was guilty of endangering my child. My mother ended up adopting my oldest, and it took a lot for me to realize that not even my child could help me get sober. And I didn't understand why until I was blessed to be in a program called the CATS program in jail. And it taught me that I'm not just an addict, I have substance use disorder. And for a long time, I didn't understand that substance use disorder and my mental health went side by side. And learning more about substance use, learning more about my mental health has truly opened so many doors of growth for me. I get to help women today that find out they're pregnant and have opiate use disorder, meth use disorder, alcohol use disorder, and more importantly, I get to advocate for them and let them know they aren't alone. I have two children. One is 12, one is 4. By the grace of God, my 12-year-old does not remember her mother as an addict, but her mother as a nurturer and a mother who advocates for addicts in recovery and harm reduction and changing their life. My 4-year-old knows nothing about addiction, and I'm so grateful for that. But the great thing about what USARA has had to offer me is that I get to teach my children warning signs. I get to teach my children how to advocate for themselves and learn how to say no. It seems so simple, but in reality, having peers support you, whether it's negative or positive, it's a huge impact on one's life. I truly believe that everyone could benefit from peers in recovery, in mental health, in day-to-day lives. That's why there are life coaches. You know, it doesn't matter whether you're addicted to sex, drugs, people, you know, food. A lot of people say that just reaching your hand out and talking and not giving it so much power is the most freeing thing, and it truly is. So with that being said, I have a background, of course. I always thought I was going to be working fast food for the rest of my life. And up until 2 years ago, I was. I managed a Subway, and I capped out at 14 an hour, and I thought that was pretty good for, you know, what I did in my past and who I've become. And that's not the case. Today, I am a certified peer recovery coach. I continue to get CEUs. I just barely finished an internship for certified peer recovery coaching, as well as just starting an apprenticeship, which is so crazy how life works. When I first got out of jail, I didn't know how to, even though I took the CATS program, I did not know how to become a mother. I did not know how to become an adult. When they say, you know, you use substances for so long that the time that you get sober is the time or the age that you were when you started the substance use, it is so correct. I literally felt like I was this 15-year-old with a child and living with my mother, and what she said went, you know, including talking with the lines of being a mother to my child. I was just like, anything nanny says, you know, ask nanny, ask nanny. And it was very, very hard for me to transition into motherhood. And I had a friend reach out to me and say, you know, we're hiring at USARA. And I'm like, what is USARA? I had no idea what I was walking into. And it was just during COVID, and I had not lost my job, but I had lost my daycare. And so I was not able to come in. And my boss at the time was saying, or he was my owner of Subway, he was like, just bring your kids in. We need people, bring your kids in. And my child was 1. And so I did. And a week into that, I was so stressed and I felt so unvalued that I finally said, you know what? I'm just going to try. I'm just going to write this application, see what they say. What's the worst that can happen? And first things first, they said, what is USARA? And I looked at them and I said, I have no idea. All I know is that people in recovery work here. And they looked at me and said, okay, well, let's start off by asking about your recovery story. So I go on to what I know, you know, and I start telling my story. And right then and there, they said, oh, we have a few other people. We'll call you back. Well, they did that 3 times. I had 3 interviews. It was the most scariest thing that I had ever had to walk through in sobriety. And I was on my way camping one day, and of course it was up Parley's Canyon where I didn't have service, and they're like, Karissa, we want to tell you, you got the job. And I was like, oh my gosh, and the phone hung up. And so I was just like in tears, and I was like telling them like, I want the job. I had to drive back down the mountain. I was pulled over to the side of the road. My kids are just like, Mom, you are nuts. And I'm just like, I want the job. I want it. I accept. And that's when my life changed. I learned more about, I continue to learn. I just did a training for mental health first aid. I enrolled back in college, and I've had to pay tuition out of pocket, which is so hard because I've messed up where I didn't take school seriously when I first got out of jail. And things keep happening that are allowing me to succeed and stay in school. With this new apprenticeship, they said if you take college courses, they will actually help pay for your tuition for that course. And I was like, I'm never going to take human development, blah, blah, blah. Well, I just enrolled for fall, and human development is what I need. And it is just such an overwhelming experience to constantly have a reminder coming at me that I'm at the right place. And I get to do this today, and I get to be with my peers and continue to advocate. And I can't stress this enough that having this job and doing what I do with pregnant women and everyone that I meet at the hospitals and detoxes, this is what I need to stay sober. It does not only help them, it helps me greatly. And selfishly enough, I have to say, as long as it's going to help me, I'll continue to help them. And that's the cool thing about recovery, is being able to help others and they help you. I'm going to share a little bit about USARA. I was going to see if Vanessa wanted to just do a quick intro, introduce herself as well, and then we'll go into what USARA is and what Arches is about.
Hi. Oh, sorry, it's like echoing over here. My name's Vanessa. So I'm just giving a quick.
Yep.
Okay. So I have a lot. I have a huge past. My recovery date is September 22nd, 2018. I'm an ex-heroin addict, meth addict, salt addict. I didn't just choose to go get treatment or get help. I got sent to prison. I went to federal prison. I went to state prison. My federal stay did not save me. I just couldn't wait to get high. I was on federal paper for 3 years. I actually had to deliver one of my babies in federal lockup. It was the worst pain I've ever felt in my life. My addiction didn't start until I was a little bit older. I was probably about 23. My mom's boyfriend killed her and gave her a hot shot of dope. And so that kind of I mean, I don't want to blame my addiction on that, but like I had fractured a finger, I was on pills. And then once that happened, like I just didn't care about anything and I just went off the hook. I was in bed for 2 weeks. I never thought depression was a real thing until that happened. And I was like, oh my God, I can't get out of bed. I can't even do anything. So after that, I started using heroin and then dabbling with crack, and then it went to meth and then bath salt. But like I was slamming it every day, all day long, robbing men all day long. Like my life was crazy. I would literally be running up and down North Temple being chased by men because I robbed them. And that's actually what sent me to prison was aggravated robbery, both times, feds and state. When I went state, I ended up losing I had 3 kids at that time. I lost all custody of all of them. And then I had 2 more. And anyways, I lost all my kids, but I have contact with 2 of them, my 16-year-old and I have custody of my 7-year-old. I only got out of prison probably 2 years ago, exactly 2 years ago in October. Let's see, there's so much, God, I'm just going through so much. But like my dad recently died probably 2 months ago from cirrhosis of the liver. Like, you know, I have a huge family history of addiction. And when I got out of prison, my aunt, she's been in recovery for 12 years, and and it's so true when they say it's not what you know, it's who you know, because I never ever thought that I would ever be working for USARA or like be doing what I am today or excel how I have today. She got me an interview with Switchpoint. It's like they run homeless shelters. And from there, I moved to USARA. She ended up getting me a interview with USARA, and it was a group interview. And I was so terrified. I was like shaking in the interview. We had our main boss in here, and I'm just like sweating. And I'm just like, listen, I'm just going to be straight up with you guys. I never thought any of this was possible. And I am terrified. Like, it was like my voice was crackling. It was horrible. But they told me the same thing as they told Karissa. Well, we have a lot of people to interview, so we'll get back to you probably in a week. Well, the next day I got the email and they're like, we're hiring you. And I was like, oh my God, I'm so happy. And that changed my life because without USARA, like, I don't even know what I would do today because I still go through things right in my life. Hard things. Like my husband keeps relapsing. I had to leave him. Oh God, why did it? I have to leave him because he's compromising everything I've worked so hard for. I just got custody of my son, and I got my son out of a really bad situation. And I told my husband, I'm like, listen, I've forgiven you time after time, and like, I won't forgive another relapse. Well, he relapsed again, and, you know, I had to get rid of him. I had to get a protective order on him. I had to call his PO, and, you know, he's staying away now, but it hurts. And like, without USARA and Karissa and all my coworkers, like, I don't know where I would be today. Because like I'm in such a bad headspace, and I really didn't want to do this project scope today, but I was like, okay, I got to show up because that's what it's about, right? Is showing up and being able to show up, not having to, but getting to, and just being okay for my son. Like I'm going back to school. I've built my credit so good. Like things are so good in my life, but then there's that, you know, and it's hard, but I'm just super grateful for the support that I have and the job that I have. It's been really hard, you know, going to the women's VOAs and going to see women in hospitals that talk to me about their problems and talk to me about, you know, their abusive relationships and stuff like that. And I'm trying to be an advocate and a role model. And I'm thinking to myself, look at the life you're living behind closed doors. People don't really know. So I had to make a change. As much as I love him, I had to make a change, and I had to let him go. And I mean, it's been so hard. Karissa knows all too well. She's been taking care of me. But like if I didn't have my job and what I do, like the passion for it, like I just don't even know that I would make it. Like it makes me feel so good when I go up to the hospitals or when I talk to these women or these men, and like I tell them a little bit of my story, and they're like, oh my God, you know, like if she can do it, I can do it. So I just love that we give people hope. I don't really focus on the time that I have sober because I don't know. I just never been that person that like, oh, I got 5 years, I got 3 years. Like, I just like to live in the now and be here for today. I know that recovery is hard and you can't do it alone, you know? And so when I go up to these hospitals and like I follow up with these people, it's just so amazing because like they look at me and they see like the tracks on my arms and the life that I lived. Like, my sister's in the streets in her addiction, my brother's back in prison, you know, my mom and my dad are both dead. Like, yes, I have some family support, but like I lost all my kids, 5 of my kids, I lost all my kids. I have contact with my 16-year-old and I have custody of my son. And I'm just so grateful for that because one day, hopefully they will come back into my life, and I'd rather be where I'm at today than like, you know, pity party, slamming heroin because I can't cope with the pain. And I'm just so grateful for prison. Like, I remember walking outside of the prison yards, like out into the yard and being like, oh my God, I'm so grateful. I'm so happy. Like, this is paradise. Like, I have no worries right now. Like, I'm sober and I'm just focused on right now. And people will look at me like I'm so crazy. Like, oh my God, you're weird. But prison was the best thing that ever happened to me because I wouldn't be where I am today. Like, I would never have gotten sober on my own ever. And so I love my job. Another thing I wanted to mention was the University of Utah. So we go up to the University of Utah for the Bridge program, and you have to be approved, like a background check and stuff like that. And like, it took me so long and I got denied and I was a mess and I was just bawling and I was like, I'm never gonna, you know, be anything with the charges I've had. And, you know, with a little hard work and time, you know, I was just like, okay, if it'll happen when it's meant to happen. And it did happen. And I'm so happy about it. And like, I just feel so proud because I've made all this progress. And I've made a vow not to let anybody bring me down. And my husband was bringing me down. And yeah, so our lives aren't all peachy, you know, rainbows and butterflies. Like, we have hard shit going on, excuse my language. But we have each other and support, and that's what we are, and that's what we try to, you know, let people know, is that we are here to support you, not tell you what to do, not push anything on you, but just be here beside you, because nobody could do it alone. I don't care who you are. But yeah, that's who I am. There's so much more, but I'm not gonna keep going and go. We could talk all night.
See, I told you, hopefully I was going to get her to just do it. I told you, this team, we're close knit, we're teeny. We have a team of 4 and it's bigger than a huge stadium. You know, it's not about quantity, it's all about quality. So a little bit about Arches. Vanessa was saying about going into the hospitals and stuff like that. We are trained in crisis management, harm reduction, hospital protocol, and medicated assisted treatment, as well as referring them. With our job, we're on call 24/7, 7 days a week, Monday through Sunday. No matter what time you call, you are able to talk to one of us. If it's opioid overdose, if you need naloxone, Narcan, fentanyl test strips, we have it all. Now, with bridging the gap, what Arches peer recovery coaches do, we try to empower our individuals to meet them where they're at, meaning I said in the beginning, if it's harm reduction they're looking for, we will be there to support them and give them resources for that. And if it's abstinence, we will give them resources and support them on that. We can make referrals to detoxes and call around, and we're very familiar with Salt Lake County and what services they have to offer, as well as treatments and outpatients. We constantly like to do presentations from New Vision and IMC and U of U and all different places, Matter, and just to keep up with what they have to offer, and if it's a fitting for one of our participants that we meet with. We have a lot of partnering agencies in Salt Lake County. We have Volunteers of America. We have the social detox as well as the women and children. We have the University of Utah, which has the emergency department and bridge program, like Vanessa was saying, as well as Fifth West, Super Rad, and Uni. And once they leave the ED, the bridge clinic, and the behavioral health, we are able to go there. We have USARA in all different counties. We have them in St. George, Moab, Price, Ogden, and our main office is in Salt Lake City. We are actually, I'm proud to say, proud and not proud, but we are the only functioning ARCHES team right now. There are St. George, they are getting into some of the hospitals as well as Ogden, McCady, and in our future, we would love to have all of our ARCHES in each one of our USARAs. Like I was saying, we're on call 24/7. In order for us to see a patient in the hospital, the crisis worker, the nurse, the social worker, doctor, whoever is willing to call ARCHES or know about ARCHES will call us, give us the patient information, their substance use disorder, and we will go and deploy typically within the hour, sometimes sooner. Now, there are times where they are in active detox and they are not ready. If they want to schedule a couple days out, we are more than happy to see them as well. We go to IMCs, or we go to St. Mark's, Salt Lake Regional as well, LDS Hospital, and we even go as far as Altiview and Riverton. So as well as me just explaining, we just started a presentation with New Vision. So we'll be getting referrals from New Vision as well, Jordan Valley. So since April 2020, just to give you guys kind of what we've done so far, and now of course the numbers are probably doubled or tripled, we have served 2,169 people, and getting their contact information, navigating treatment. A lot of people that we do see are homeless or misplaced, so we aren't able to reach out to them. That's why I choose, and I think all of our coaches I could speak to, give out ARCHES cards, and on the ARCHES cards has our first name, last name, my cell phone number. Vanessa has hers as well, our USARA line, our extension, our email, all of our contact information to make sure that they can stay engaged. And if USARA is something that they want to do, we are there. I've had participants that aren't ready, like I said, harm reduction, and maybe they don't want USARA services while they go through that. And I've had people hit me up 9 months later, and it doesn't matter when we meet you, where we meet you, we would love, that's the cool thing about USARA, is there's no time. Now with Super Rad, I like to go into Super Rad a little bit, just because this is a huge part of both of our stories with our children and substance use disorder. It's a struggle every day, you know, especially seeing these women that are so, you know, some of them are trafficked, some of them are so broken, some of them have inner partner domestic violence. And we've made it so as a clinic, with USARA's input, that the patient goes in alone. Before it was, they can bring their significant other in, they can bring their parents in. But I know with, you know, my past, it's very difficult to be 100% honest and open without feeling judgmental towards yourself, as well as thinking, oh my God, what does my mom think? Or I didn't tell him that. I hope he doesn't hurt me because of that, you know. And not every partner is going to be abusive, but it's very, very prominent that we let the person know that we are there to support them. We're not there for their husband, their mother, because we do have resources for that. We have male coaches, we have family support, craft, which is reinforcement training to, you know, teach the loved ones that you don't just, like we said, we're multiple pathways. So we literally approve of every single pathway, from rational recovery to 12 steps to Dharma recovery, which is a Buddhist meditation approach. And we also do advocate for Al-Anon, but we have set up as USARA a craft which teaches the family members to love their loved ones through their substance use disorder, that it is a disorder, and that once you start living your life and walking beside them and, you know, doing your own self-care, that it's a little bit easier, you know, than to sit there, worry, and say, what do I do next? We have support for all types. We do groups, one-on-one coaching, which would be the downstairs coaches. And it's, of course, a coach like us, but instead of us being their first initial, we would meet with them. And if long-term coaching is something that they would like to do, they are able to meet with a coach free of charge, once a week, however often they would like. And we also have the downstairs coaching with FRC, CPS, DCFS, and it's really cool that we, even us, are able to advocate for our participants in that way. Now, we do groups at USARA as well as virtually. I know that you guys work with women with children, and anybody really can go to our groups, and we have parents in recovery group. We have women's support, men's support. We have everything under the sun. And if they're not able to make it in person, it's hybrid. So with that being said, we would love to open for Q&A. I know we've probably missed so much, and there's so much. Oh, and I wanted to let you know, just so you could, you know, if anyone asks you exactly what we do, what we don't do. So I know a lot of people refer to us coaches as sponsors. We are not sponsors. What is a recovery coach? It's a person who is in long-term recovery from a drug or alcohol addiction. We support all pathways of recovery, and we advocate and we're a confidant. Now, what a recovery coach does: listens without judgment, shares lived experience, assists with resource navigation, and empowers and encourages. We definitely suggest at times, but we don't ever tell anyone what to do. What a recovery coach is not: we're not a 12-step sponsor, we're not a treatment program representative, and we're not a counselor or a therapist. And that's a big difference of what we are. We're not clinical at all. We like to walk right beside you, not in front of you.
Karissa and Vanessa, thank you so much for sharing your
Janelle?
story. And I just really appreciate it. And Vanessa, did I cut you off? Were you going to say something and I interrupted you? No.
Oh no, I had you on mute for some reason. So
Okay.
Yeah.
Well, thank you. And I cannot see the participants, so I'll have to change my view, but go ahead and if you guys have any questions, either just unmute and ask your questions. I'll monitor the chat as well. But and I guess I have this question to both of you, are there things that as an early intervention provider, when we have families that are mothers or families that are experiencing this, some of the things that we can do to help support them when we are in their homes?
So are you looking for suggestions or?
Any of that? Yeah, like what's the best way to approach that, and how do we help without making it feel judged, or is there something that you wished would have happened in your guys'
Oh yeah. Okay, so what we wished would have happened. Okay, from my personal experience, a lot of it was I felt like, oh, okay, so a lot of times when I had people talking to me about like, okay, what can we do to help you get on the right track? Like, what can we help you to stay off heroin, stuff like that. My mind was all over the place and I had no idea. One thing that I've learned, we've done a lot of CEUs, motivational interviewing, is ask questions, open-ended questions. I can't stress that enough because I don't want to assume what they need help with. I don't want to assume that they're going to want help. So open-ended questions like, what would you like to see happen in the next week? What is one goal that you've been thinking that is definitely hard to reach? What can I do to support you? That's one of our biggest things, is what can we do to support you? Sitting beside them, not in front of them. I mean, you can always learn, but one thing that has truly helped me was learning about motivational interviewing, questions to ask.
Great. And then it looks like there's a couple of questions. So how do you get the referral to the hospitals?
So the referral to the hospital is going to be the social worker, the resident nurse, like for instance at LDS, we have, or Salt Lake Regional, there's resident nurses. We even have doctors at the U of U give us calls and referrals. Basically anyone in the hospital setting, as well as detoxes and behavioral units. What they'll do is they'll call and say, I've talked with this individual and they are interested in USARA services. Now, that is for us to deploy. Okay. Now, if you want somebody just to get USARA services, somebody to talk to, you are more than welcome to walk in Monday through Friday, 9 to 5. We're located on 180 East, 2100 South, and I'll send this to Janelle. This is actually our Arches phone number that is 24/7, 7 days a week. And one of us will answer and kind of navigate where you want to go next, what you want to talk about, stuff like that. And whether it's a long-term coach, there is a waiting list on long-term coaches. So what we generally like to do is we give them soft handoffs. So the upstairs coaches, which is me and Vanessa, what we'll do is we will do 90 days with follow-up calls, making sure that they're engaged. And once they are engaged, we will give them a soft handoff to a coach. And at any time, it's very pertinent that you guys know that if they're not comfortable with that coach, the best thing to do is advocate for themselves. We have amazing coaches from all walks of life. We have those who like to say they've never been in trouble but have substance use disorder. Whatever they feel comfortable with, you know, there's a huge genre of coaches and stories and backgrounds. So. Oh yeah, and everyone that works at USARA, including our executive director, is in recovery.
That's amazing. Another question is, do you have any volunteers that work with your program?
So we just barely started our walk-in hours again. Before it was just like a short window that you had come in, walk in, talk with the coach. Now it's everything's getting back to normal. Monday through Friday, 9 to 5, we're going to start our volunteer opportunities again. We have a lot of volunteer opportunities. It's just, it would be an event. It would be like Recovery Day coming up in September. And we also have volunteer opportunities. But yes, we do have volunteer opportunities. You can sign up through USARA and get a hold of us as well. And we can point you in the right direction. And it is for both men and women, yes. we do, the one thing I did want to say, so there are, like, you know, with ethics, there's yes, no, and in between. We do not coach people that are under 18. There has been some exceptions, like the Super Rad clinic. We did have a 15-year-old in the clinic where we were able to coach her. Her parents were there with her in the appointments. And so that's where we did our coaching. But generally, we do not do that, but we can outsource you to somewhere else where you're able to get help for parents or people that are underage.
There are questions people have for Karissa and Vanessa. Oh, Pat. Okay.
I couldn't figure out how to raise my hand in the chat.
Okay.
So I'm Pat, and I do both worlds. I work in the NICU as well as in the community in early intervention. And I think through the years, the lack of coordination with all of the agencies has been very frustrating for me as a therapist. I'm a physical therapist, and I work with the babies and the families. So I think one of the issues with the Eat, Sleep, Console program at the University of Utah was following these kids once they, who knows where they go, to foster care, to guardian placement, or home with their families. So how do you envision your agency tying the services in the community with the families that you counsel? Have you thought about that?
Yeah, so we actually are trying to work on getting the numbers to that. Like I said, it's very difficult to get an exact number just because we do, in the emergency settings, we do work with a lot of homeless and displaced that don't have phones and stuff like that. But generally, when we see them in clinics and stuff like that, what we began to see is that we're meeting them more than once. And it's unfortunate, but it's good at the same time because we're able to, you know, reiterate who we are. And I wish that every single time we met with somebody, they're like, yeah, we want you. Sometimes it takes a couple times, you know, and I just think making sure that you know, introduce yourself, make it short but sweet, but let them know, like, I am just here to support. You know, making it as less clinical as possible to those who are maybe afraid, scared, new. But that is a very difficult, and one thing that we'll constantly probably be working on is bridging that gap.
Okay, I guess what I'm trying to say is that we're your number one supporters, okay? And how do you get in the back door so people like us can use you? I know you go through this, I mean, you go through
Yeah.
So I think the issue here is coordination, collaboration, and continuation of support of that whole.
Okay.
So families don't lose their kids. So the kids don't get neglected. So we're all on the same page together, working towards the goal of staying sober and raising children in a healthy environment.
Yeah. So I think now that we're open, doing walk-ins are welcome. Or getting into the NICU or getting it. Okay.
So I don't even know if you know do you know what early intervention is?
No. Can
Okay.
you touch more on that?
Okay, so our focus as interveners is to start early. And so children who have been prenatally exposed are referred to our program, and we cover the entire state of Utah. We're a mandated service to provide developmental support to that family and child, pointing out, why don't you put your baby on your tummy? Why don't you feed the baby in this position? What have you noticed that baby's communication cues? So we're working with the family, but our target is the child, whereas your target is sobriety and the parent, and that's all of our targets. So how do we, as community programs working in the NICU, collaborate with you? I understand how to refer.
Okay, I'm so sorry.
Yeah, don't worry about it. Don't worry about it. We're an unknown service. So
okay, so what you would do is get our contact information. Every Wednesday we have a team meeting, and we would love for you to present. Give us all your information and any referral that you have for your early intervention. What you would do is ask the mother. I do have USARA as a resource. Is that something that you're interested in? And if they are in a clinical setting with you, you can actually call us, and we can, if it's in Salt Lake County, we can go deploy there within the hour. We can go and schedule a meeting, do a phone, a one-on-one phone, whatever they're comfortable with. And so just getting you heard to our Arches team and getting your contact information, as well as you getting our contact information, that's how you would bring us in. And that's it.
Okay, well, I think that's a higher pay grade than me. So I really think that, I don't know, Janelle, is that something that this program can try and tie together?
I definitely think that we should look at doing that, tying together, doing some child find. So Karissa, as you guys were just talking, that I was thinking that's probably one of the things, as I am the Learn the Signs Act Early Ambassador, and it's working on this early identification of developmental monitoring, that we can tie our early intervention and early signs, because as we can help support the families, like Pat's sharing, those families to keep their kids or to know how to work and interact with their kids, that's going to help that whole family system a lot more. So
yeah,
I think so. And Kyla's going to jump.
This might be a good opportunity. So Dan and I, for Plan of Safe Care through DCFS, have actually started, fingers crossed, meeting with all of the labor and delivery heads for the state of Utah to talk about, and early intervention is one of the boxes on Plans of Safe Care, right? And really trying to say, and USARA is one of the boxes on there. And so we'll be doing some education about creating these with parents, that we know have issues with SUD or anyone who tests, working on this prior to that DCFS referral, which I think might open the door to us having those cross learning meetings, right? Because then they could say, oh, here's an event that would love to have USARA come talk at, or here's something that early intervention can present at. So like, we'll have the form with the boxes of all of us on there that technically is federally mandated that we're supposed to be doing anyway. And then be able to hopefully open that door to me being able to give USARA's information and early interventions and all of those warm contacts. So we're really hoping in the next 2 months, we'll actually make some big progress on this. So knocking on wood and fingers crossed, but we're getting them scheduled. So I'm excited.
I would really love that, because USARA or Super Ad's a great program, but as you know, that's not the only hospital that's going to be having SUD pregnant women give babies. And so there's a huge community that we have not reached, and a lot of women that aren't getting the support that they deserve. And so I think that that is so huge. And I don't see why we wouldn't be able to do that with who we are as a team.
The other place, Karissa, I'm just going to totally opportunistically take advantage of this. Sorry. The other place that we're really looking to try to get into because we did a great listening session with some of your coworkers at USARA that talked about a lot of times people in active addiction are finding out they're pregnant in like Instacare clinics. And then when we did some of our outreach to the Department of Health with those clinics, they're like, oh, that's not my wheelhouse. I just deal with the emergency thing and have them move on. And one of the barriers that they've told us is, well, I'm worried about time. I'm worried about liability. I don't know that system to help navigate. And I'm wondering if that isn't a great place for USARA to partner and be like, look, you don't have to tell the parent all the things that's out there, but if you know that they're pregnant and they're in active addiction, here's a card of someone who can help this person navigate it. And it's not a referral to an agency. So I don't know, that might be something to explore.
Yeah. And we are working right now to try and get more grants so we can actually expand our USARA team, because we are a nonprofit, and expand them so we can futuristically go into Instacares and stuff like that, because we're so central that it will be easy for us to get places really quickly. But we did once, I don't know, I'd have to talk to my supervisor about it, but I did go to the Redwood Clinic and drop off Arches cards. And we had somebody call on us, and we talked with them over the phone, and it was awesome. So maybe just getting us to drop some things off.
I'm going to throw my email in the chat, because there's actually like funding tied to this federal position. So if that's something that we can pass through to USARA to expand that.
Yeah, I would love that.
But I don't want to hijack this whole thing, but I think that to the question of how do we actually connect to this, there's some work that we're trying to do that I think could help with that. And I think for the cross learning of early intervention and explaining what all the options are for things that are not, because I think everyone knows about us, like they know about DCFS because we're the big scary monster in the room. But it's really awesome to have things that actually bring up all the other options long before we ever have to show up.
Yeah,
For sure.
Yeah, I love that.
Great conversation. Natalie, I see you have your hand up, and then there's a couple of questions in chat.
So yeah, I just want to make sure. So I have a family in Richfield that I'm currently building some rapport with that I want to refer to you. And I heard you say you have Arches in Richfield, in Price. So would I refer to the Price Arches, or would I refer to you guys? How would that work? And would that be the closest place?
So Price does not have Arches, but Price does have, so Price has 2 coaches, and if they know all of the resources and everything for Price.
Richfield is what, still 2 hours away from Price, but in my little geographical brain, I was thinking that was the closest one, but I could be wrong.
Yeah, well, I mean, we always let people know that we can meet virtually, we can meet over the phone. It doesn't matter where you're located. I mean, I meet people that are in Wyoming, you know, and
this mom doesn't even have an email, and so it's hard to even get her a link. So anyway, I have some things I need to work on, but
yeah, well, if it's easier for you, for us to give you actual USARA like papers, Arches cards, we could do that too if she can't get it emailed.
But she could just do it over the phone, right? You guys could do a phone. Okay, perfect.
Always.
Okay, the next question is as early childhood providers, I'm wondering, what would you consider the best ways to engage parents with substance misuse issues? So Karissa and Vanessa, what do you guys think?
So like, how would you be finding out if they have substance use misuse?
Kelly, it's
That
your
would probably
question. Do you want to come
Yeah, I think we're in the home, and we have family educators that go into the home. And so, you know, we're fortunate that we do have more connections with families through our program. And so with our early Head Start services, we can be in there weekly. With our Head Start services, we're in there quarterly. But, you know, there are conversations or questions regarding that in some of the conversations. So I was just wondering if we do notice that or see that a family is, I mean, just how do we engage them with their families? How can we help prevent parents from losing their children? How can we provide you guys that support so that, you know, potentially we can work with you and provide you the support from that happening?
One thing that I know that the social workers say and stuff like that, because in order for us to show up, they do need to explain who we are and if they're willing to meet. So when you're in the homes, maybe just, you know, have you ever heard of USARA? And, you know, USARA stands for Utah Support Advocates for Recovery Awareness, which is on the card. You could just read off of it. And then just say, everyone who works there is in recovery and they're certified peer support. Is that something you'd be interested in? You know, and from there you would put the ball in their court, give them the information, and have them reach out to us and what we could provide for them, you know, because a lot of it is they're gonna kind of want to be like, some of them are going to want to get the help, some of them are going to want to get the harm reduction, unfortunately, when you have the children in the home. But we can at least start there.
Vanessa, did you have anything that you wanted to add to that question? Okay, if you don't.
Sorry, I'm just not in the mood today. I'm so sorry. I'm just going through a lot. I'm really sorry, but she does amazing.
You guys are good. I just don't want to not give you the opportunity before I move to the next one.
Thank you.
The next question is are you connected with Help Me Grow?
No, we are not.
So it sounds like Kyla, what you're talking about, that cross connection, cross training, helping all of us understand who we are and what we can all do to support. Because while early intervention providers, we need to know who you guys are. That's another great way. And then Tressa just put, here's the link. She's put some information about the Baby Watch Early Intervention Program throughout the state for you guys. And then also, does USARA have a location in Ogden?
We do have a location in Ogden. And then I saved that for the Baby Watch. 211 does know about us. And in Ogden, if you go on our website, I'm going to put our website in the chat box. If you go on our website, it will show locations, phone numbers for the locations, meetings that are going on in those locations, and if they're in person or virtual, and kind of, you know, give basic info about what USARA is.
Other questions or things that you have to share or that you guys want to know more about? I always really appreciate you being willing to share your lived experiences. It helps us as early child care providers understand that process behind the scenes and helps us be able to do a better job. So thank you again, both of you, for willing to share that story and help us understand that.
Yeah, anytime. We love presenting and being able to have the opportunity to expand and grow and connect. And I think this is awesome.
Okay. Well, if there are no more questions, we are going to go ahead and wrap up. And then just as a reminder, we are having our next session on June 22nd at noon again, where we will be having Pat Boyle talk to us about trauma, substance exposure, and sensory concerns. So feel free to join us and register, and then don't forget to take your surveys. And a huge shout out again to Karissa and Vanessa for sharing and joining with us. And there's one more question. Can you be
Yes.
medically? The answer is yes. Okay.
Yes, and that's why we support multiple pathways. So that is a great question. I was also going to say too, Janelle, if you want to post our contact information on a email, any other questions that were answered, we could definitely get back to you. And then also anything that we've talked about today about the DCFS, the NICU, all of that. If you guys want to shoot us an email so we can talk more about that, I would love that.
Great. That will be fantastic. It's always good to get the same brains in one spot so that we can make some good kind of policy changes. So thank you all for joining and asking those great questions and just sharing again. You guys are amazing. So thank you.
Thanks.